My name's Ashlynn Vonderheide. I'm one of the nurse practitioners and I float around the clinics. I got my actual nursing degree. I got that at Cox College and I did a couple years there and got my bachelor's degree as well. Then from there I ended up going to Walden University, which is more of like an online program, but you're able to go out and do clinicals pretty much out in the area. So I was able to do my clinicals around the Springfield area and around the Mountain Grove area. I was actually in the Mountain Grove clinic for Mercy, so I was there for almost a couple years. So I'm getting pretty familiar with a lot of the faces around town. Whenever you leave and come back, it's hard to remember all the faces until you get to see them every so often. So I've honestly lived in Mountain Grove for pretty much my entire life, except for my little stint that I ended up going to Cox, and I lived up in Springfield for that time. I also ended up going to C of O for a little bit as well, so I was there for about 2.5 years. But any other place has just been with Mountain Grove. I love having a different change in scenery, so that's nice. And I like that I can actually see more people, get to see more new faces, so that's always nice. I'll mainly be fluctuating, I think she told me, between Kabul, Mountain Grove, and the Mansfield area. Sometimes I can travel a little bit over to Houston, sometimes Ava if they need me to, but mainly between those three. Especially whenever you say you have a provider have an emergency and they technically call out, it makes it hard on them because they have to cancel all those appointments or try and reschedule it. So it kind of makes it harder on the patient because they probably took off work that day to actually make that appointment. So if I'm technically able to come in and help fill in a gap, then that makes it a little bit easier for everyone. So I did a lot of the walk-in acute care stuff over at the clinic I was previously at. We'd run into a lot, especially with even dental pains. You get a lot of patients that are coming in and they're like, well, my dentist wants me to have an antibiotic, but I can't technically do anything with my dentist until I've been treated and the infection's gone. Well, sometimes they don't have a dentist that they're even going to. They just know that they're having multiple cavities and that they need to come in and be seen and hopefully get that addressed, but they never had the money to technically go get it taken care of. So it was just a battle that we continued to fight. Well, I like here, technically I can go in, I can treat them, I can even pull a dentist into the room and just have them meet the patient from the get-go. Even if they can't do anything that day, I at least know by the time we get them walked out, we can get them over to the desk on the dental side, so that way we can get them set up for an appointment, so I know it'll get taken care of. And I know that's frustrating for a patient because a lot of the times like, well, I don't have time to go see a dentist, I don't have time to do this. Even with the psychiatric mental health side that we're bringing on, that I'm really, really excited about. That's something that we don't have a lot in this area. I feel like we've had to send to Springfield quite a bit, but now Springfield's getting to the point that they don't even have openings for those patients. So I hate always telling them, well, we might have to wait a couple months. Well, here we don't have to. Here we can get you on the schedule. We can get you hopefully seen within the month and get it all addressed. So that's gonna be so nice. I'm more that upfront. I'm gonna tell you what I'm gonna do, but I'm gonna do it in the nicest way possible. But I just don't want there to be any surprises. If you have any concerns, then we address it, we get it taken care of, or at least we try and get you someplace that will address it. So I don't like to beat around the bush. And when it comes to your health, it's something that we need to address right then and there because I don't want it to turn into anything later on. I absolutely love my kids. I could spend all day outside with them. That is all they love to do. Going to the lake, I love to read. I actually, in school, reading was not my favorite thing. Something about me getting out, and it was mainly just in my years of being a nurse practitioner, you needed that mental break, and I could never find, okay, what can I do to kind of get myself into a different mind space, because I always felt kind of dragged down whenever you're going through school, you're learning so much. And something about reading a good book, one of my friends actually, they steered me towards that, and it's just one of those things that kind of gets me out of the world for a minute, so that way my brain can kind of relax. So I love to do that. Pretty much just being outside. Sports I loved. I ended up playing volleyball at C of O, so I did that for college. My husband was the same way. He ended up playing baseball, which is how we met. But that's something that we've always liked to do. If we can go to any type of MLB game, we love doing that, basketball game, just like that.